A three-star general stood at attention in a civilian hospital. Every doctor froze, except the one he was saluting. For more stories like this, subscribe to Emergency Heroes Stories. 6 weeks earlier, the comment came during morning rounds. Dr. Raymond Castellane stood at the head of the conference table, arms crossed, silver hair immaculate even at 6:20 in the morning. 15 residents lined the walls of the cramped meeting room. Coffee cups balanced on knees, tablets glowing with patient charts. Nora Reeves sat in the back corner, second year, 34 years old, still treated like she had walked through the door yesterday. Castellane tapped the imaging on the screen. Gallbladder, inflamed. Routine surgical candidate. Who takes this one? Nora kept her eyes on her tablet. She had learned, in 6 weeks, that silence was safer than volunteering. Dr. Chen? Castellane's voice carried the particular tone of a man who enjoyed being the smartest in the room. Lisa Chen, third-year resident, glanced at the scan. Straightforward cholecystectomy. Standard laparoscopic approach. 4 ports. Dissection of the triangle of Callot. Castellane nodded. Textbook. He turned toward the back. Dr. Reeves, would you add anything? Nora looked up. Her hands rested flat on the table, still. Always still. The cystic duct looks slightly dilated. I would check for choledacrolithiasis before proceeding with standard dissection. Castellane's eyebrow arched. Based on what? The ultrasound shows no stones in the common bile duct. The dilation pattern suggests intermittent obstruction. It could be missed on a single image. I would run an MRCP before surgery. The room went quiet. Chen's jaw tightened. Castellane smiled, the kind that did not reach his eyes. Dr. Reeves, are you suggesting I missed something? I'm suggesting an additional scan would confirm the approach, sir. He stepped closer. His voice dropped, but everyone heard it anyway. You have been here 6 weeks. Dr. Chen has been here 3 years. I have been practicing surgery for 30. Do you think you see something we do not? Nora met his gaze. No, sir, just recommending thoroughness. Castellane turned back to the group. Dr. Reeves will take the gallbladder case. Since she is so thorough, she can handle it herself. A few residents shifted. Chen looked down at her tablet. Dismissed. The room emptied in under a minute. Nora stayed in her seat, reviewing the chart on her screen. She adjusted her surgical cap as she stood. For a moment, the edge lifted, exposing the small tattoo behind her left ear. An eagle, a serpent, a rod, the medical corps symbol, tiny, precise. In the doorway, Sergeant Major James Okafor paused. He was hospital security now, retired Army, 52 years old, and still built like he could run a full ruck march before breakfast. He had been passing by when the meeting let out. His eyes locked on the tattoo. He said nothing, just narrowed his gaze, then moved on. Nora pulled the cap back down. She did not notice. If you want to see how Dr. Nora Reeves performs a surgery that should be impossible, make sure you subscribe to Emergency Heroes Stories, because what she does in the next few minutes will leave you speechless. Where are you watching from? Let us know in the comments. The pre-op bay smelled like antiseptic and recycled air. Nora stood at the scrub sink, hands under the water, counting the seconds. 15 on the fingers, 15 on the palms, 15 on the forearms. Her movements were mechanical, efficient. The attending surgeon assigned to supervise never showed. Typical for a routine case. Nora did not mind. She preferred working alone. The patient, a 46-year-old man named Dale Pressman, was already under when she entered the OR. The anesthesiologist airily looked up. Vitals stable. He is all yours. Nora positioned herself at the table, scalpel ready, monitors humming. She made the first incision, clean, controlled, 8 centimeters, just below the ribcage. The scrub nurse handed her the retractor without being asked. Nora placed it with one hand, angled precisely for exposure. Her fingers moved like they had done this 1,000 times. They had. She dissected through tissue layers, isolating the gallbladder. The cystic duct came into view, and there it was, a stone, lodged in the common bile duct, exactly where she said it would be. The dilation was worse than the imaging suggested. If she had followed standard protocol and cut without checking, the patient would have been back in surgery within a week. Maybe sooner, maybe with sepsis. She did not pause, did not call for the attending. She knew what to do. Nora reached for the choledocoscope, a flexible scope, thin as a pencil. She threaded it into the duct, visualizing the stone on the monitor. The nurse glanced at the screen, then at Nora. That is a second-year procedure. Nora did not look up. It is the correct procedure. She maneuvered the scope, positioned the basket, and extracted the stone in one smooth motion. No flourish, no hesitation. The duct cleared. The bile flowed. She closed the incision with interrupted sutures, each knot identical, each stitch placed with the kind of muscle memory that does not come from textbooks. The anesthesiologist checked his watch. 47 minutes, start to finish. He looked at Nora. You have done this before. Training. He did not ask what kind. In the observation room above the OR, Dr. Castellane stood with his arms folded. He had been watching the surgery on the monitor. He rewound the footage, watched her hands again, the way she placed the retractor, the angle of the scope insertion, the sutures. His face was unreadable. Dr. Chen stood beside him. She did not say anything, but her eyes stayed on the screen. Nora stripped off her gloves in the hallway outside the OR. She disposed of them in the biohazard bin, washed her hands again, and checked the post-op orders on her tablet. Everything was clean, no complications, patient stable. She turned toward the locker room. Sergeant Major Okafor was standing near the corridor intersection, arms loose at his sides, watching her. Their eyes met. He gave a single slow nod. Nora paused, just for a second, then kept walking. She did not know why he was looking at her like that, but part of her did. The locker room was half empty when Nora walked in. Two residents sat on the benches near the showers, still in scrubs, voices low, but not quiet enough. Did you see the way she handled that scope? Lisa Chen pulled her hair into a ponytail, eyes focused on her locker. That was not beginner technique. The other resident, a second year named Marcus, shrugged. Maybe she studied videos. You can learn anything online now. Chen shook her head. Nobody learns to thread a choledocoscope like that from videos. That takes repetition. Dozens of cases. Marcus leaned back against the lockers. So what are you saying? She lied on her application? I am saying something does not add up. Chen closed her locker. 6 weeks in, and she is performing like a fifth year. Where did she come from? Nora stood just outside the doorway. She did not step in, did not announce herself. She turned and walked toward the stairwell instead. By noon, the story had spread. The resident who called the stone nobody else saw. The one Castellane tried to embarrass. The one who was right. Nora ate lunch alone in the third-floor break room. A protein bar and black coffee. She kept her eyes on her tablet, reviewing the afternoon schedule. The door opened. Dr. Castellane walked in. He did not pour coffee, did not sit, just stood in the center of the room, looking at her. You were right about the stone. Nora looked up. Yes, sir. How did you know? The dilation pattern on the ultrasound. The angle suggested intranetant blockage. Castellane folded his arms. That is not something most second years would catch. I review cases carefully. He stepped closer. That tattoo, behind your ear. Nora set down her coffee. Medical symbol. I got it during my training. What kind of training? General surgical training, sir. His eyes narrowed. Where? Nora met his gaze. Her voice stayed level. Does it matter? Castellane smiled. The same one from the morning. It matters if you are hiding something. I disclosed everything required on my application. He studied her for another long moment, then nodded. Keep up the good work, Dr. Reeves. He left. Nora exhaled slowly. She finished her coffee in silence. At 2:15, the assignment board updated. Nora pulled it up on her tablet. Appendectomy. Room 6, routine case. She changed into fresh scrubs and headed to pre-op. The patient was a 19-year-old college student named Jeff Maldonado. Elevated white count, right lower quadrant pain, nausea for 2 days. Classic presentation. Nora introduced herself. Jess was nervous, pale, gripping the bed rail. "You are going to be fine. This is one of the most common surgeries we do." He nodded. His knuckles stayed white. Nora reviewed his chart while the anesthesiologist prepped the IV. Vitals stable, imaging clear, straightforward. But something felt off. She leaned closer to Jeff. "Maybe low grade. Any nausea before the pain started?" "Yeah, like 2 days before." Nora pulled up the CT scan on the tablet. She zoomed in on the appendix. Inflamed, yes, but the surrounding tissue showed subtle streaking. Not much, just enough. She scrolled to the lab results. White count was high, but not extreme. Elevated lactate. Barely. She looked at Jess again, smelled the air near him. Faint, sour, metallic. Her jaw tightened. She turned to the anesthesiologist. "Hold the sedation." "What?" "Do not sedate him yet. I need to talk to the attending." The anesthesiologist frowned. "He is prepped. We are on schedule." Nora was already moving toward the door. 2 minutes. She found the attending in the hallway outside the OR. Dr. Paul Hendricks, late 40s, competent but perpetually rushed. "Dr. Hendricks, I need you to look at the Maldonado case." "The appendectomy?" He glanced at his watch. "What about it?" "I think he has early peritonitis. The CT shows tissue inflammation beyond the appendix. His lactate is elevated. He smells septic." Hendricks pulled up the chart on his phone. "His vitals are within normal range for pre-op anxiety. They are borderline. If we do a standard laparoscopic approach and the appendix has already ruptured, we are looking at a much bigger problem." Hendricks sighed. "Dr. Reeves, I appreciate thoroughness, but we cannot delay every routine surgery because of a hunch." "It is not a hunch. The signs are there." He looked at her. His voice dropped. "You have been here 6 weeks. I have been doing this for 18 years. The case is routine. Proceed as planned." He lurked away. Nora stood in the hallway, her hands curled into fists, then released. She went back to pre-op. Jeff was still awake, still gripping the rail. Nora leaned close. "Jeff, I am going to take very good care of you, but I need you to trust me. If anything looks different than expected, when I open you up, I am going to handle it. Okay?" He nodded. She turned to the anesthesiologist. "Let us go." The OR was cold. Nora stood at the table, scalpel in hand. She made the first incision. Small, controlled. The laparoscope went in smooth. She angled the camera toward the appendix, and there it was, ruptured. Pus in the abdominal cavity. Early sepsis, exactly like she predicted. She did not hesitate. Suction. Irrigation. "I need a larger access point." The scrub nurse stared. This was supposed to be laparoscopic. It was. Now it is not. Nona extended the incision, converted to open surgery. She worked fast, suctioning infected fluid, debriding necrotic tissue. Removing the ruptured appendix, her hands moved in rapid sequence. No wasted motion, no second guessing. The nurse handed her instruments before she asked, watched her work with something close to awe. In the observation gallery, Sergeant Major Okafor stood alone. He had come up on a hunch, watched the whole thing. He whispered to himself, "That is field surgery." Nora closed the abdomen with interrupted sutures, the same kind she used that morning. Precise, identical, military standard. She stripped her gloves. Jeff is going to need broad-spectrum antibiotics and close monitoring for the next 48 hours. Start him on piperacillin tazobactam. The anesthesiologist nodded. He did not argue. Nora walked out of the OR. Her scrubs were stained, her hands steady. Dr. Hendricks was wilting in the hallway, arms crossed. "You were right." Nora stopped. He stepped closer. "How did you know?" "Experience." "What kind of experience?" "The kind that teaches you to trust your instincts, sir." He studied her face, then nodded. "Good work, Dr. Reeves." She walked past him toward the locker room. Okafor was standing near the stairwell, watching her again. This time Nora stopped. She looked at him, said nothing. He looked back, also said nothing. Then he walked away. Nora stood alone in the corridor, her reflection in the glass window beside her. Tired eyes, straight posture. She pulled off her surgical cap. The tattoo behind her ear caught the light. She covered it again, headed for the stairs. The observation gallery was supposed to be empty at 3 in the morning. It was not. Lisa Chen sat in the back row, tablet balanced on her knees, replaying surgical footage from earlier that day. The appendectomy, the one that was not supposed to be complicated. She had watched it 4 times already. The way Nora converted from laparoscopic to open, the speed of the transition, the suture technique. Chen zoomed in on the screen, watching Nora's hands tie each knot. Identical tension, identical spacing, identical structure. She had seen that pattern before, in a medical journal, an article about combat surgical techniques, interrupted sutures, military standard. Chen set down the tablet, stared at the dark observation window. Her phone buzzed. A text from Marcus. "You still up?" She typed back. "Watching Reeves' surgery again." The reply came fast. "You are obsessed." Chen did not respond. She closed the tablet and left the gallery. Morning rounds started at 6:30. Castellane stood at the head of the conference table, coffee in hand. Residents arranged in their usual pecking order. Nora sat in the same corner, second row from the back. Quiet. Castellane tapped the screen. "Hold up Jeff Maldonado's post-op report. Appendectomy with complications. Ruptured appendix, peritonitis, converted to open procedure." He looked around the room. Dr. Reeves identified early sepsis that imaging missed. She made the correct call under pressure and potentially saved this patient from a much worse outcome. The room stayed quiet. A few residents glanced toward Nora. She kept her eyes on her tablet. Castellane continued. "That said, the decision to convert to open surgery without consulting the attending is a breach of protocol. Dr. Reeves, in the future, you wait for supervision." Nora looked up. "The patient would have been septic by the time supervision arrived, sir." Castellane's jaw tightened. "That is not your determination to make." With respect, it was. I was the surgeon in the room. The call was mine. The tension in the room thickened. No one moved. Castellane set down his coffee. Slowly. "My office. After rounds." He moved on to the next case. Nora stayed still, her hands flat on the table, breathing steady. Chen watched from across the room. She saw something in Nora's posture. The way her shoulders did not tense, the way her hands did not fidget. That was not the body language of someone afraid. That was the body language of someone who had been here before. Castellane's office was small and cluttered. Diplomas on the wall, stacks of medical journals on the desk, a window overlooking the parking lot. Nora stood in front of the desk. Castellane sat behind it, hands folded. "You have been here 6 weeks, Dr. Reeves. In that time, you have contradicted attendings twice, performed procedures above your clearance level, and demonstrated skills that frankly do not match your resume." Nora said nothing. Castellane leaned forward. "So I am going to ask you directly. Where did you train?" "I completed my surgical residency at County General." "That is what your file says. But your file also has gaps. 3 years unaccounted for between undergrad and medical school. Another 2 years with vague descriptions of volunteer work abroad. I worked in rural clinics, low-resource settings. Doing what? General medicine, trauma care when necessary." Castellane opened a folder on his desk, pulled out a printed page. "This is your background check. Standard hospital protocol." It flagged something interesting. Nora's face did not change. "You are listed in a Department of Defense database, Medical Personnel Registry." "Why would a civilian doctor be in a military database?" Nora met his eyes. "I provided care to service members during my volunteer work. It is not uncommon for civilian doctors working in conflict zones to be logged for coordination purposes." Castellane studied her. "That is your explanation?" "That is the truth, sir." He leaned back in his chair. "I do not believe you." Nora stayed silent. Castellane closed the folder. "But I also cannot argue with results. Your patients are alive because of you. So here is what is going to happen. You keep doing excellent work. You follow protocol. And you stop making me look like I do not know what I am doing in front of my residents." "Understood, sir. Dismissed." Nora turned and left. Castellane watched the door close, then picked up his phone and dialed. Dr. Vivian Park answered on the second ring. "We need to talk about Nora Reeves." The trauma bay was quiet at 11 in the morning. Nora sat in the corner, reviewing charts on her tablet. 2 nurses restocked supplies. A paramedic refilled the oxygen tanks. The radio crackled. All units, mass casualty alert, military training accident, multiple trauma incoming. ETA, 8 minutes. Everyone stopped. The charge nurse grabbed the radio. How many? 6 patients, 3 critical. IED simulation malfunction. The trauma bay exploded into motion. Nurses pulling crash carts. Doctors appearing from hallways. Attendings barking orders. Nora stood. Her tablet went into her pocket. Her face shifted. Something imperceptible. A change in the eyes. Castellane appeared in the doorway, still pulling on gloves. He pointed at residents. Chen, Trauma 1. Kowalski, Trauma 2. Reeves, Trauma 3. Nora moved toward the 3rd bay. The least critical. Always the least critical. The ambulances arrived with sirens screaming. Paramedics rushed gurneys through the doors. Blood, smoke smell, shouting. Nora's patient came in on the 2nd gurney. Young, male, maybe 23. Shrapnel wounds across his chest and arms. Conscious but pale. The paramedic rattled off vitals. BP 90/60. Pulse 110. Multiple fragmentation wounds, no active arterial bleeding. Stable transport. Nora stepped to the bedside. Looked at the wounds. Her eyes narrowed. She leaned closer. Examined the metal fragments embedded in his skin. The pattern, the size, the discoloration. She touched one piece with a gloved finger. Turned it slightly. Her jaw tightened. She looked at the patient. What is your name? Private Dylan Webb, ma'am. Dylan, what kind of ordnance were you training with? Decommissioned IEDs, ma'am. Training simulation. Nora picked up forceps, extracted one fragment. Held it under the light. The metal was dark. Oxidized. Specific striations along the edges. She had seen this before. In Helmand Province. In Kandahar. In a dozen field hospitals where the enemy used Russian-made components. This was not decommissioned training ordnance. This was real. She looked at Dylan's chest. The wounds were shallow, surface level, but one fragment sat just below his ribcage, right side. The trajectory angled upward, toward the pericardium. Nora set down the forceps, pulled off her gloves, walked straight to Castellane in Trauma 1. Dr. Castellane, I need you to look at my patient. He did not turn around. Busy, Reeves. This is Russian-made IED shrapnel. Real combat ordnance. One piece is migrating toward his heart. Castellane glanced over his shoulder. They were using decommissioned devices. You are overthinking. I am not. This fragment pattern is specific to RGD-5 grenades. Soviet era. The metal composition is wrong for training simulation. Castellane turned back to his patient. His vitals are stable. Handle the surface wounds. We will reassess if anything changes. Nora stood there. Her hands curled into fists. She walked back to Trauma 3. Dylan looked up at her. Am I okay, ma'am? Nora pulled on fresh gloves. You are going to be fine, Private. I promise. She began removing the surface fragments, one by one. Her hands steady, her mind calculating. The fragment near his heart had not moved yet, but it would. She knew it would. Sergeant Major Okafor appeared in the doorway of Trauma 3. He watched Nora work for 10 seconds, then stepped inside. He moved close, quiet enough that only she could hear. I know who you are, Major. Nora's hands stopped, just for a heartbeat. She did not look at him. Okafor continued. Kandahar, 2018. I read the after-action reports. You were right then, too. Nora's voice was barely a whisper. I am not that person anymore. Okafor looked at Dylan, at the fragment near his heart, then back at Nora. Yeah, you are. He left. Nora stood over Dylan, her hands hovering. Above the fragment she could not touch, not yet, not without permission. She looked at the monitor. Vitals stable, for now. If you want to see what happens when a 3-star general discovers who really saved his son, make sure to subscribe to Emergency Heroes Stories. Drop a comment and tell us where you are watching from. Dylan Webb's vitals stayed stable for 40 minutes. Nora finished extracting the surface fragments, cleaned the wounds, applied dressings. She worked methodically, but her eyes kept returning to the monitor. Heart rate steady, blood pressure holding. The fragment near his pericardium had not moved. Yet. She stepped back from the bed. "Dylan, you are going to be admitted for observation, 24 hours minimum." He nodded, tried to smile. "Thanks, Doc." Nora stripped off her gloves. She walked to the nurse's station and logged the orders into the system. Admit to surgical ward, cardiac monitoring. Serial chest x-rays every 4 hours. The charge nurse glanced at the orders. "This seems excessive for superficial shrapnel wounds." "It is not excessive. It is necessary." The nurse did not argue. She processed the admission. Nora turned toward the locker room. Her shift was technically over. 16 hours, 2 surgeries, 1 mass casualty event. She was exhausted, but she did not leave. She sat in the break room, drank cold coffee, kept her pager on the table in front of her. At 2:47 in the afternoon, it went off. Code blue, surgical ward, room 418. Nora was moving before the second beep. She hit the stairwell at a full run, took the stairs 3 at a time, burst through the 4th floor door, and sprinted down the hallway. Room 418, Dylan Webb. She pushed through the door. The room was chaos. 2 nurses, a respiratory therapist, Dr. Hendricks at the bedside, stethoscope pressed to Dylan's chest. The monitor screamed. Heart rate spiking, blood pressure dropping. Dylan was awake, eyes wide, gasping. Hendricks looked up. "He is crashing. I do not know why." Nora moved to the bedside, pushed past the nurse, ripped open Dylan's gown. A fragment, it moved. She could see it. A small bulge under the skin, right side of his chest, just below the sternum. She pressed her fingers against his ribcage, felt for the heartbeat, muffled, distant. Cardiac tamponade. The fragment punctured his pericardium. Blood is filling the sac around his heart. Hendricks stared at her. "How do you know that?" "Because I have seen it 14 times before." The door opened. Castellane walked in, took in the scene. "What is happening?" Nora did not look at him. The fragment migrated into his pericardium. "He needs an emergency thoracotomy, now." Castellane stepped closer. "We need to get him to the OR. He will be dead before we reach the elevator." Castellane's voice rose. "Dr. Reeves, you cannot perform open chest surgery in a hospital room." Nora turned, locked eyes with him. "Watch me." She grabbed the crash cart, pulled it to the bedside, ripped open the sterile pack. Scalpel, retractor, suction. Hendricks backed away, his face pale. Castellane did not move. "Dr. Reeves, you are not authorized to do this." Nora positioned the scalpel over Dylan's chest. "Then fire me after I save him." She cut. One motion, clean, through skin, through muscle, between the ribs. Blood welled up. Nora suctioned it away. Her hands moved without hesitation. Castellane stood frozen, watching. Nora spread the ribs with the retractor, exposed the pericardium. It was swollen, taut, filled with blood. She picked up a smaller scalpel, made a controlled incision in the pericardial sac. Blood poured out. Dark, venous. Dylan gasped. His pressure started to rouse. Nora reached inside. Her fingers found the fragment. Small, sharp, embedded in the pericardial membrane. She pulled it out, held it up to the light. Russian-made, just like she said. She dropped it into the steel tray with a sharp clink. Then she looked at Castellane, her voice calm, steady. "I have done this 14 times. In Helmand Province, under rocket fire." The room went silent. Chen appeared in the doorway, stared at the open chest, at Nora's hands inside Dylan's ribcage. Nora did not stop. She inspected the pericardium, found the puncture. Small, clean, suture, 4O proline. The nurse handed it to her, hands shaking. Nora stitched the pericardium closed, her movements precise. Each stitch placed with muscle memory that could not be faked. She spoke while she worked. "Major Nora Reeves, United States Army Medical Corps, Special Operations Command, serial number W4782193. Hendricks took a step back. Castellane just stared. Nora continued suturing. 3 combat tours. Iraq, 2011 to 2012. Afghanistan, 2015 to 2018. 843 combat surgeries. She tied off the last suture, checked the pericardium. No bleeding. "This is number 844. She began closing the chest, layer by layer. Muscle, fascia, skin. Her sutures were identical, perfect, military standard. The monitor stabilized. Dylan's heart rate dropped to normal, blood pressure climbing. Nora stepped back, stripped off her gloves. He is stable. Get him to the OR for proper closure and drain placement. No one moved. Okafor stepped into the room. He had been standing in the hallway, watching through the door window. He looked at Castellane. I can confirm her identity, sir. Major Reeves served with H distinction. I have seen her service record. Castellane found his voice. You were military. Nora met his eyes. I was a lot of things, sir. Why did you not tell us? Because I wanted to leave that world behind. Castellane opened his mouth, closed it. The elevator chimed down the hall. Footsteps. Fast. Heavy. A man in army dress uniform appeared in the doorway. 3 stars on his shoulder. Graying hair. 50 years old and still built like infantry. Lieutenant General Marcus Webb. He looked at Dylan, at the open chest, at the blood on Nora's scrubs. Where's my son? Castellane stepped forward. General Webb, your son is stable. We performed an emergency procedure to address a cardiac complication. The general's eyes scanned the room, landed on Nora. He saw the sutures in Dylan's chest. His face changed. He stepped closer, looked at the stitching pattern. Recognition hit him like a freight train. Who did this? Castellane hesitated. Dr. Reeves performed the procedure. The general turned to Nora. What is your full name, doctor? Nora straightened. Major Nora Reeves, sir. Retired. The general stared at her. His expression shifted. Disbelief, then certainty. Forward Operating Base Sharana, 2017. Coordinated attack. 12 casualties. You saved my entire medical unit during that overrun. Nora's breath caught. You remember. The general's voice was quiet. I recommended you for the Silver Star. The room was completely silent. General Webb came to attention. He raised his right hand and saluted. On behalf of the United States Army, the Medical Corps, and my family, thank you, Major. Every person in the room froze. Nora stood perfectly still. Then, slowly, she returned the salute. Her hand sharp, precise, no hesitation. The kind of salute that erased any doubt about who she was. The general held it for 5 seconds, then dropped his hand. Castellane looked like he had been punched. Chen stood in the doorway, mouth open. Okafor nodded once. Silent respect. Dylan's monitor beeped steadily. His chest rose and fell. Alive. The general looked at his son, then back at Nora. Why are you here, Major? Why are you not still serving? Nora's voice was quiet. Because I was tired, sir. Tired of command failures. Tired of politics deciding who lives and who dies. The general's face hardened. Kandahar. Nora nodded. He exhaled. I read the Inspector General report. Command failed you. Those deaths were not your fault. Nora said nothing. The general stepped closer. But you saved my son today, and that makes you a hero twice over. Nora looked at Dylan. I just did my job, sir. The general shook his head. No, Major, did far more than that. He turned to Castellane. I want a full report on how this hospital has been utilizing Major Reeves' talents. And I want to know why a decorated combat surgeon is being treated like a first-year resident. Castellane's face went white. The hospital administration conference room smelled like old carpet and stale coffee. Nora sat in a chair facing the window. She had not been invited to sit. She sat anyway. Dr. Vivian Park stood near the door, arms crossed, tablet pressed against her chest like a shield. Dr. Castellane sat at the head of the long table, hands folded. His face was unreadable. General Webb had left 20 minutes ago. Back to his son's bedside. Back to watching monitors and waiting for Dylan to wake up fully from sedation. The silence in the conference room stretched. Park broke it first. Dr. Reeves, we have a significant problem. Nora did not turn around. My patient is alive. I do not see the problem. Park stepped closer. You omitted critical information on your application. Military service. Combat experience. Years of surgical practice that would have changed your residency placement entirely. I disclosed what was legally required. My service record was sealed at my request when I transitioned to civilian life. That is my right under federal law. Castellane leaned forward. It is also our right to know who we are hiring. You hired a competent surgeon. That is what you got. Park's voice rose. You lied by omission. Nora finally turned, looked at her directly. I did not lie. I chose privacy. There is a difference. Park set her tablet on the table, hard enough to make a sound. Your presence here is a liability. If the press finds out we have a former special operations surgeon working under a second-year residency clearance, the optics alone could be devastating. Castellane raised a hand. Vivian, let us take a breath. Park ignored him. Furthermore, your unauthorized thoracotomy in a patient room violates a dozen hospital protocols. You could have killed that man. Nora stood. Slowly, her voice stayed calm. That man was dying. Protocol would have let him die. I did not. Park stepped closer. You do not get to make that call. Nora met her eyes. I was the only one in that room qualified to make that call. The door opened. Okafor stepped inside. He was not invited either. He closed the door behind him. Park turned. This is a private administrative meeting. Okafor did not move. With respect, ma'am. I think you need to hear what I have to say. Castellane gestured to a chair. Go ahead, Sergeant Major. Okafor stayed standing. I served with the 75th Ranger Regiment, Medic, Mogadishu, 1993. I have seen combat surgery under fire. I know what it looks like. He looked at Nora. What Major R. Eves did today was not reckless. It was textbook special operations medical protocol. She identified a life-threatening condition, assessed the risk of transport, and made the correct tactical decision. That young man is alive because she did not wait for permission. Park's jaw tightened. This is not a battlefield. Okafor's voice hardened. No, ma'am, it is not. But medicine does not stop being medicine just because you are not being shot at. Major Reeves used the skills she earned through years of service to save a life. Punishing her for that is not just wrong. It is disrespectful. Park opened her mouth, closed it. Castellane leaned back in his chair. Dr. Reeves, why did you not tell us? Nora looked at him. Because I wanted to practice medicine without carrying the weight of what I did before. I wanted to be judged on my work, not my history. Castellane nodded slowly. And you were right, about the gallbladder stone, about the appendix, about the fragment near Dylan Webb's heart. Every single time, you were right. Nora said nothing. Castellane stood, walked to the window, looked out at the parking lot below. I owe you an apology, Dr. Reeves. I underestimated you, dismissed you, made assumptions based on your rank and your silence. He turned to face her. That was wrong. Nora's expression did not change. Apology accepted, sir. Park stepped forward. That does not resolve the liability issue. Castellane's voice sharpened. There is no liability, Vivian. She saved a general's son. The army will back her. The family will back her. And if we try to punish her, we will look like fools. Park's face flushed. So we just ignore protocol? Castellane looked at Nora. No, we change it. Nora's eyes narrowed. What does that mean? Castellane walked back to the table, sat down. I want to offer you a position. Senior trauma surgeon. Immediate appointment. Full surgical privileges. Nora stared at him. I am a second-year resident, on paper. In reality, you have more trauma experience than anyone in this hospital, including me. Park stepped between them. Raymond, you cannot be serious. Castellane did not look at her. I am completely serious. Dr. Reeves has demonstrated exceptional skill, judgment, and composure under pressure. She belongs in a leadership role, not shadowing attendings on routine cases. Nora's hands tightened on the back of the chair. I left the military to get away from leadership. Castellane met her eyes. I am not asking you to lead soldiers, Major. I am asking you to lead surgeons. Teach them what you know. Build a program that bridges combat medicine and civilian trauma care. Nora looked away, toward the window. Her reflection stared back, tired eyes, blood still on the collar of her scrubs. I do not know if I can do that. Castellane's voice softened. Why not? Because the last time I tried to lead, people died. The room went silent. Okafor spoke. Kandahar. Nora's jaw tightened. She did not respond. Okafor stepped closer. I read the IG report, Major. Command delayed your medevac request for 40 minutes because of political optics. You did everything right. They failed you. Nora's voice was barely a whisper. I was treating children, civilians caught in crossfire. I called for airlift. They said it would compromise the mission profile. By the time they cleared the flight, 3 of those kids were gone. She turned to face them. Her eyes were dry, but the pain was visible. I left because I could not carry that anymore. Could not make decisions knowing politics might overrule medicine. Castellane's expression softened. That will not happen here. Nora looked at him. You cannot promise that. No, but I can promise you autonomy. Complete surgical independence. You make the calls. No one overrides you. Park stepped forward. Raymond, that is an extraordinary amount of authority. Castelaine did not break eye contact with Nora. She has earned it. Nora looked at Okafor, then at Castelaine, then at Park. What would the program look like? Castelaine smiled. That is up to you, but I am thinking a trauma fellowship track. Advanced tactical medicine for civilian application. Training residents and attendings in high-pressure decision-making. He leaned forward. You would design the curriculum, choose your staff, set the standards. Nora was quiet for a long moment, then she spoke. 3 conditions, Castelaine nodded. Name them. First, the program is open to veteran doctors transitioning to civilian practice. No questions about gaps in their resumes. No judgment about their service. Done. Second, I want Okafor as the program coordinator. His experience bridges both worlds. Okafor straightened, looked at Castelaine. Castelaine nodded. Agreed. Nora looked at Park. Third, I want a written guarantee that my military record stays sealed unless I choose to disclose it. My past is mine, not PR material. Park hesitated, then nodded. I can draft that. Nora took a breath. Then, I accept. Castelaine stood, extended his hand. Welcome to the senior staff, Dr. Reeves. Nora shook it, her grit firm. Park gathered her tablet. I will start the paperwork. She left without another word. Okafor smiled. Looks like you are stuck with me, Major. Nora almost smiled back. Could be worse, Sergeant Major. Castelaine walked to the door, paused. One more thing, Dr. Reeves. Nora looked at him. Thank you. See, not giving up on that young man, for trusting your instinct. Even when we did not trust you, he left. Nora stood alone in the conference room with Okafor. He looked at her. You did the right thing. Nora stared out the window. I hope so. She pulled off her surgical cap. The tattoo behind her ear caught the afternoon light. She did not cover it this time. Dylan Webb opened his eyes 6 hours after surgery. The ICU was dim. Monitors beeped softly. His father sat in the chair beside the bed, still in uniform, elbows on his knees. Hands folded. Dylan tried to speak. His throat was dry. General Webb looked up, reached for the water cup, held the straw to his son's lips. Dylan drank, coughed once. Dad, I am here. What happened? You had a piece of shrapnel near your heart. It moved. You crashed. Dylan's eyes widened. Am I okay? General Webb nodded. You are alive because of a surgeon who refused to let you die. Dylan looked at the ceiling, tried to piece together fragments of memory. The training accident. The ambulance, the hospital, a woman's voice telling him he would be fine. Who was she? Her name is Major Nora Reeves. She is the reason you are breathing. Dylan closed his eyes. I need to thank her. You will. The door opened. Nora stepped inside. She wore clean scrubs now, hair pulled back, the tattoo behind her ear visible. General Webb stood immediately. Major. Nora raised a hand. Please, sit. He did not sit. How is he? Nora moved to the bedside, checked the monitors, looked at Dylan. Heart function is strong. No signs of infection. You are going to make a full recovery, Private. Dylan looked at her. My dad says you saved my life. Nora adjusted the IV line. I did my job. General Webb's voice was firm. Major, you did far more than that. You performed a battlefield procedure in a civilian hospital without backup, without an OR, and without hesitation. Noya met his eyes. I have done it before, sir, 14 times. The general nodded slowly. Sharana, I remember. 6 of my people would have died that night if you had not been there. Nora's expression did not change, but something flickered in her eyes. I lost 2. You saved 6. Under fire. With limited supplies. That kind of performance does not get forgotten. Nora looked down at Dylan. He was watching her, his eyes clear now, focused. Thank you, ma'am. Nora's voice softened. You are welcome. She turned to leave. General Webb stopped her. Major, I need to ask you something. Nora paused. Why did you leave? The room went quiet. Dylan looked between them. Nora took a breath. Because I was tired of command decisions overriding medical ones. Tired of being told who was worth saving based on politics instead of need. The general's jaw tightened. Kandahar. Nora nodded. I read the full report, not the sanitized version, the real one. Nora looked at him. The general's voice dropped. You were treating 12 civilians, 7 children. You called for medevac 3 times. Command delayed it for 40 minutes because the optics of evacuating Afghan nationals during an active operation were deemed politically sensitive. Nora's hands curled into fists. 3 of those children died waiting. The general stepped closer, and the officer who made that call was relieved of duty 6 months later. It is in the classified addendum. You were exonerated, recommended for commendation. Nora's voice was hollow. I do not care about commendations, sir. I care that I had to watch children bleed out because someone decided their lives were worth less than a headline. The general was silent for a long moment. Then he spoke, quietly. I am sorry, Major, for what the system did to you. For every doctor and medic who has had to make impossible choices because leadership failed them. Nora looked away. It is in the past. Is it? She did not answer. Dylan spoke, his voice weak, but steady. Man, if you had not been here today, I would be dead. Whatever happened before, you are still saving lives. That has to count for something. Nora looked at him, then at the general, then at the monitors showing Dylan's strong, steady heartbeat. She nodded once. Get some rest, Private. She left. General Webb watched the door close, then sat back down beside his son. Dylan looked at his father. She is not okay, is she? No, but maybe she will be. The auditorium was packed 3 weeks later, 200 seats. Standing room only in the back. Doctors, residents, nurses, paramedics. A dozen people in military uniforms scattered through the crowd. Nora stood at the podium. A projection screen behind her showed a tactical medical diagram. Field triage protocols. She wore hospital scrubs. No rank insignia. No medals. Just her name embroidered on the chest. Dr. Nora Reeves. Her voice carried clearly, confident but not loud. Combat medicine and civilian trauma care are not as different as you think. The principles are the same. Assess, prioritize, act. The only difference is context. She clicked to the next slide. A photo of a field hospital. Tents. Dust. Blood on the ground. In theater, you do not have time to second guess. You make the call and move. Hesitation kills. Overthinking kills. You trust your training and your instincts. She looked out at the audience. That is what I want to teach you. Not how to work in a war zone. How to bring that clarity and decisiveness into your practice here. A hand went up in the third row. Lisa Chen. Nora nodded. Dr. Chen. Chen stood. How do you train instinct? Nora paused. You do not train instinct. You train pattern recognition. You expose yourself to enough scenarios that your brain starts seeing the signs before your conscious mind catches up. She clicked to the next slide. A list of clinical signs. Subtle, easy to miss. This is what we are going to focus on. The quiet warnings. The things that do not show up on a monitor until it is too late. Another hand. A man in army fatigues. Late 20s. Nora recognized the look. Veteran. Medic, probably. She pointed to him. Go ahead. The man stood. Ma'am, I am transitioning out next year, trying to get into PA school, but I keep getting told my field experience does not count the same as civilian hours. Nora's expression hardened. That is going to change. This program will provide accreditation pathways for combat medical experience. If you have kept people alive under fire, you do not need to prove yourself in a classroom. The man sat down, relief visible on his face. General Webb sat in the back row, arms crossed, watching. Okafor stood near the exit, also watching. Nora continued. Over the next 6 months, we will be running intensive simulation training, high-pressure scenarios, limited resources, impossible decisions. You will make mistakes. You will lose patience. She leaned forward. And that is the point. Better to fail here than in a real crisis. The room was silent. Nora clicked to the final slide. A quote. Excellence is not about never making mistakes. It is about making the right call when everything is falling apart. She looked out at the faces, some skeptical, some inspired, some desperate for what she was offering. Questions. Hands shot up across the room. Nora pointed to a young resident near the front, a woman, early 20s, nervous energy. The resident stood. Dr. Reeves, what do you do when you know you are right, but no one listens? Nora was quiet for a moment. Then she spoke. You act anyway, and you accept the consequences. The resident sat down. Nora looked at the clock. We are out of time. First session starts Monday. 0600. Do not be late. The room began to empty. People filed out, talking in low voices. Excited, uncertain. Chen approached the podium. Dr. Reeves, I want to be in the first cohort. Nora looked at her. You already are. Chen smiled, then left. General Webb walked down the aisle, stopped in front of the podium. Nora looked at him. Sir, that was impressive, Major. Thank you. The general handed her a folder. This came through official channels this morning. Department of Defense wants you to consult on a national trauma curriculum, military and civilian integration. They are offering a contract. Nora took the folder, did not open it. Are you going to accept? I do not know yet. The general nodded. Dylan is being discharged tomorrow. He wanted me to tell you he is going back to active duty. Desk assignment. Says he wants to serve in a way that honors what you did for him. Nora's throat tightened. He does not owe me anything. Maybe not, but he wants to anyway. The general extended his hand. Whatever you decide, Major, thank you for everything. Nora shook it. Take care of your son, sir. I will. He left. Nora stood alone at the podium. The empty auditorium stretched out in front of her. She looked at the folder in her hands, ran her thumb along the edge. Then she set it down, turned off the lights, and walked out. 6 months passed like breathing. Steady, inevitable. The trauma simulation lab opened on the second floor. 8 beds, full monitoring equipment, mannequins that bled, breathed, and crashed on command. Nora stood in the center of the room every Monday at 6 in the morning, waiting for the first cohort to arrive. They always arrived early. Chen was the first through the door every session, then Marcus, then a former Navy corpsman named Rodriguez, who had seen 3 deployments and wanted to be an ER doctor. Then others, residents, attendings, paramedics, a retired Air Force surgeon who had spent 20 years doing field medicine and wanted to teach. Nora ran them through scenarios, mass casualty events, equipment failures, ethical dilemmas with no clean answers. She did not go easy on them. One morning, she set up a simulation. 4 critical patients, 2 residents, 30 minutes. Chen and Marcus scrubbed in. The mannequins activated. Alarms started screaming. Chen moved to the first patient. Tension pneumothorax. She reached for the needle decompression kit. Nora's voice cut through the noise. You have 1 needle, 4 patients. How do you know this one needs it most? Chen froze, looked at the monitor, looked at the other patients. She moved to the second bed, checked vitals. Moved to the third, then the fourth, then back to the first. She inserted the needle. The patient stabilized. Nora nodded. Why that one? Chen's voice was steady. Respiratory distress with tracheal deviation. The others were critical, but not immediately life-threatening. This one would have arrested in under 2 minutes. Nora walked to the second bed. And this patient. Marcus stepped forward. Hemorrhagic shock. Needs fluids and pressure. I can manage that while Chen handles airway. Nora watched them work. Efficient, communicating, no wasted movement. The session ended. All 4 patients stable. Nora turned off the simulation. Good, but not perfect. Chen looked up. What did we miss? The 3rd patient had early signs of compartment syndrome. You stabilized the bleed but did not check distal pulses. In a real scenario, he loses the leg. Chen's face fell. Nora's voice softened. That is why we practice. You will see it next time. Chen nodded, wrote notes on her tablet. Marcus stayed behind after the others left. Dr. Reeves, can I ask you something? Nora was resetting the mannequins. Go ahead. How do you turn it off? Nora looked at him. Turn what off? The part of your brain that keeps replaying the ones you lost. Nora set down the equipment, straightened. You do not. Marcus waited. Nora spoke quietly. You learn to carry it. You acknowledge that you will lose people, that you will make mistakes, and you decide whether that stops you or sharpens you. She looked at him. Which one is it for you? Marcus thought about it, then nodded. Sharpens. Good. Then you are in the right place. He left. Nora stood alone in the lab. Turned off the lights, headed to her office. Castellane was waiting outside her door. She stopped. Dr. Castellane. He held up a tablet. I wanted to show you something. Nora unlocked the office. They went inside. Castellane pulled up a document. Trauma survival statistics. Before and after your program launched. He turned the tablet toward her. The numbers were clear. 31% improvement in critical patient outcomes, 15% reduction in surgical complications, 23% faster time to definitive care. Nora read the data, said nothing. Castellane continued. We are getting inquiries from hospitals across the country. They want to replicate the program, send their staff here for training. Nora looked up. That is a lot of people. It is, which is why I am asking if you would consider expanding. Nora leaned back in her chair. What does that look like? A regional training center, federal funding, partnership with the DoD. You would oversee curriculum development, train instructors who go back to their hospitals and implement the protocols. Nora was quiet. Castellane sat down across from her. I know you left the military to get away from bureaucracy, but this is different. This is you setting the standard. You decide what gets taught, how it gets taught. No one overrides you. Nora looked at the folder still sitting on her desk, the one Genoa Webb had given her 6 months ago. She had not opened it, until now. She pulled it toward her, broke the seal, read the first page. Department of Defense, Office of Medical Readiness, National Trauma Integration Initiative. Her name was listed as primary consultant. She set it down, looked at Castellane. This has been in the works for a while. He nodded. The general pushed it through. He believes in what you are building. Nora stood, walked to the window, looked out at the city below. Ambulances moving through traffic, lives hanging in the balance. She thought about Kandahar. The children she could not save. The weight she had carried for years. She thought about Dylan Webb, alive because she refused to wait for permission. She thought about Chen and Marcus and Rodriguez, learning to see the patterns, learning to trust themselves. She turned back to Castellane. I will do it, but on my terms. Name them. The program stays veteran-friendly. No barriers for people transitioning out of service. No stigma. No questions about why they left. Done. The curriculum includes ethical training, how to handle command failures, how to advocate for patients when the system pushes back. Castellane smiled. That might make us unpopular with some administrators. Good. He stood, extended his hand. Welcome to the national stage, Dr. Reeves. Nora shook it. Let us just make sure we do it right. 3 weeks later. Nora stood in front of a congressional subcommittee. Healthcare policy, military medical readiness, civilian trauma preparedness. She wore a simple suit, hair pulled back, the tattoo behind her ear visible. The committee chair, a senator from Virginia, looked down at her from the raised platform. Dr. Reeves, you have been described as a pioneer in combat to civilian medical integration. Can you explain what that means? Nora's voice was calm. It means recognizing that the skills developed in military medicine have direct application in civilian trauma care. And it means removing barriers that prevent veterans from using those skills when they transition out of service. Another senator leaned forward. Some have argued that combat medicine is too aggressive for civilian settings, that it prioritizes speed over precision. How do you respond? Nora met his eyes. Combat medicine prioritizes saving lives under the worst possible conditions. That does not make it aggressive. It makes it effective. Precision matters in every context. But so does decisiveness. Civilian trauma care can learn from both. A third senator spoke. Your program has shown remarkable results, but it is also expensive. How do you justify the cost? Nora did not hesitate. How do you justify the cost of losing patients who could have been saved? Every doctor and medic we train will treat hundreds of patients over their career. The return on investment is measured in lives. The room was silent. The committee chair nodded. Thank you, Dr. Reeves. We will take your recommendations under advisement. Nora stood, gathered her notes, left the chamber. Okafor was waiting in T. Key hallway. How did it go? Nora kept walking. They will approve the funding. He smiled. You sound confident. Because I gave them no reason to say no. They stepped outside. The afternoon sun was bright, warm. Okafor looked at her. You are not the same person who walked into that hospital 6 months ago. Nora stopped, looked at him. No, I am not. Is that a good thing? She thought about it, then nodded. Yes, it is. Her phone buzzed. A message from Dylan Webb, a photo, him in dress uniform. Standing beside his father, both smiling, the caption read, Back on duty, serving with purpose. Thank you, Major. Nora stared at the photo, then typed a reply. Proud of you, Private. Stay safe. She put the phone away, looked at Okafor. Ready to get back to work? He nodded. Always. They walked toward the car. The city stretched out around them, endless, full of people who needed saving. Nora felt lighter, not free of the weight, but no longer crushed by it. She carried it now. With purpose. 1 year later, the auditorium looked different, bigger, fuller. The walls covered with framed photographs. Graduating cohorts, surgeons who had completed the program, veterans who had transitioned into civilian practice, patients who had survived because someone made the right call at the right time. Nora stood at the podium. Behind her, a banner read, National Trauma Integration Symposium, Year 2. 400 people in the seats. Doctors from 18 states. Military medical personnel from 4 branches. Paramedics, nurses, emergency managers, even 2 representatives from the European Union Medical Corps. Nora looked out at them. Her voice carried clearly. 2 years ago, I performed an emergency thoracotomy in a hospital room. No operating room, no backup. Just the knowledge that waiting meant death. She paused, let the words settle. That decision changed my life. Not because it was heroic, but because it forced me to stop hiding who I was. The room was silent. Nora continued. Many of you come from military backgrounds. You have seen things, done things, carried weight that civilians cannot understand. And when you transitioned out, you were told that experience did not count, that you had to start over, prove yourselves again. She looked directly at a man in the 3rd row, former Army medic. She knew his story. 3 tours, 2 Bronze Stars. Rejected from PA school because his field hours were not considered equivalent. He was in his 2nd year of the program now, top of his class. Nora's voice strengthened. That ends here. Your experience matters. Your skills matter. And this program exists to make sure the system recognizes that. Applause started, scattered at first, then building. Nora raised a hand. The room quieted. But this is not just about veterans. It is about changing how we think about trauma care, about teaching every doctor and medic to see the warning signs before the crisis, to trust their instincts when protocol falls short, to act with precision and confidence when lives are on the line. She clicked to the next slide. Statistics. Cold, clear, undeniable. Since this program launched, trauma survival rates in participating hospitals have increased by 31%. Surgical complication rates have dropped by 15%. Time to definitive care has decreased by an average of 8 minutes. Another click. A map of the United States. Red dots marking hospitals that had adopted the protocols. 47 hospitals across 23 states. Training over 2,000 medical personnel. Treating an estimated 150,000 patients annually. The applause came again, louder this time. Nora waited for it to fade, then spoke quietly. But numbers do not tell the whole story. She clicked to a new slide. A photograph. Dylan Wedd in his dress uniform, smiling, alive. This is Private Dylan Wedd. 1 year ago, he arrived at our emergency department with shrapnel near his heart. He crashed, and someone made the call to operate immediately instead of waiting for an OR. She looked out at the audience. That someone was me. And I made that call because I had done it before, because I trusted my training, because I knew hesitation would kill him. She clicked again. Another photograph. A young woman. Civilian. Car accident victim. This is Sarah Mitchell. She arrived at a community hospital in Ohio 3 months ago. Blunt chest trauma. Stable vitals. The attending wanted to wait for imaging before deciding on surgery. Nora's voice was steady, but the ER nurse had just completed our training program. She noticed subtle signs of cardiac tamponade. She escalated. The attending listened. They operated immediately. Sarah is alive because someone saw what the monitors did not show yet. More photographs, more stories. A construction worker in Michigan, a teenager in Texas, an elderly man in Virginia. Each one saved because someone refused to wait, because someone trusted the training. The room was completely silent now. Nora spoke. That is what this program is about. Not heroism, not glory, just competence, precision. The willingness to act when action is required. She clicked to the final slide, a quote in simple text. Excellence is not about never being afraid. It is about acting anyway. Nora stepped back from the podium. Thank you. The applause was immediate. Standing ovation. 400 people on their feet. Nora stood still. Let it happen. Did not smile. Did not wave. Just nodded once. Then stepped down. Chen met her at the base of the stage. That was incredible. Nora adjusted her jacket. It was just a speech. It was more than that. Chen gestured to the crowd. Look at them. You changed their lives. Nora looked, saw the faces, the hope, the determination. Maybe. General Webb approached, still in uniform. Dylan beside him, taller now, stronger. The scar on his chest, hidden under his shirt, but present in the way he carried himself. Major Reeves. Nora straightened. General. Private. Dylan extended his hand. I wanted to thank you again, in person. Nora shook it. You already did. Not enough. Dylan's voice was firm. I am alive because you acted. My fiancé gets to plan a wedding because you acted. My future kids will have a father because you acted. He looked her in the eyes. That matters. Nora's throat tightened. I am glad you are well, Private. The general stepped forward. The DoD has authorized full funding for the next 5 years. They want to expand the program to military hospitals overseas, train forward surgical teams in these protocols. Nora absorbed the information. That is a significant expansion. It is. And they want you to lead it. Nora looked at Dylan, then at Chen, then at the crowd still filtering out of the auditorium. She thought about Kandahar, the children she could not save, the guilt she had carried. She thought about the people she had saved since. Dylan, Sarah, hundreds of others whose names she would never know. She looked back at the general. I will need full autonomy. No interference from command on medical decisions. You have it. And priority placement for veteran medical personnel in the training pipeline. Already approved. Nora nodded slowly. Then I accept. The general smiled. Welcome back, Major. Nora shook her head. Not Major anymore. Just Doctor. The general's smile widened. Understood, Doctor. He and Dylan left. Chen stayed. So what now? Nora looked at her. Now we get back to work. Chen grinned. I was hoping you would say that. They walked toward the exit together. The auditorium emptying behind them. Okafor waited near the door, arms crossed, that same expression of quiet respect he had worn since the day he first saw her operate. Nora stopped beside him. Thank you. For everything. You did this yourself, Doc. I just opened the door. Nora looked back at the empty stage. The photographs on the walls. The evidence of lives saved. No. We did it together. Okafor nodded. Then let us keep doing it. They stepped outside. The evening air was cool. The city lights beginning to glow. Nora's phone buzzed. A message from a hospital in California. Requesting consultation on a complex trauma case. Asking if she could review imaging remotely. She typed a quick reply. Send the files. I will look tonight. Another message. This one from a former Marine corpsman in her program. Just got accepted to medical school. Thank you for believing in me. Nora stared at the screen. Typed back, you did the work. Proud of you. Chen looked over her shoulder. You ever stop working? Nora put the phone away. Not really. They walked toward the parking garage. The sounds of the city around them. Sirens in the distance. Ambulances responding. Lives in crisis. Nora listened, felt the pull. The call to action that had defined her entire career. She was not running from it anymore. She was not hiding. She was exactly where she was supposed to be. Jen stopped at her car. See you Monday? Nora nodded. 0600, do not be late. Chen laughed, drove away. Nora stood alone in the parking garage. Looked up at the hospital tower. Lights in every window. People working, fighting, saving lives. She thought about the girl she had been, the soldier, the surgeon, the woman who had run from her past because the weight was too heavy. She thought about the woman she was now, still carrying the weight, but no longer alone. Her phone buzzed again. Trauma alert. Multi-vehicle accident. All available surgeons to the ER. Nora was moving before the second notification came through. She hit the stairwell at a run, took the steps 3 at a time, pushed through the ER doors. The chaos greeted her like an old friend, shouting, monitors screaming, blood, smoke smell. A nurse saw her. Dr. Reeves, we have 3 critical, 1 with penetrating chest trauma. Nora stripped off her jacket, pulled on a gown, gloves, moved to the first bed. Talk to me. What do we have? The resident rattled off vitals. BP dropping, tachycardic, possible hemothorax. Nora looked at the patient, young man, conscious, terrified. She placed her hand on his shoulder. You are going to be okay. I promise. She meant it. Her hands moved with absolute certainty. Scalpel, retractor, suction. The rhythm she had learned in a dozen war zones and carried into this clean, bright hospital. The monitor stabilized. The patient breathed. Nora stepped back, stripped off her gloves, moved to the next bed. The night stretched ahead. Long, demanding, necessary. And Nora was ready. She had stopped running from who she was. She had stopped apologizing for the skills she carried. She was a surgeon, a teacher, a woman who refused to let people die when she can save them. The trauma bay doors opened again. Another patient, another crisis. Nora took a breath, pulled on fresh gloves, and went to work.